Disclaimer before we begin. We want to remind you that the content shared on this podcast is for informational and educational purposes only. It is not a substitute for professional mental health treatment, diagnosis, or therapy. If you are experiencing a mental health crisis or need personalized care, please seek help from a qualified mental health professional. Thank you.
Welcome back, everybody. Welcome back. We're back. We're going to pick right back up from where we left off. We got Dr. Carter with us here, and we're diving back into this holistic wellness approach to just weight loss and weight management.
Yeah.
So go ahead and continue giving us some of your background, Dr. Carter.
Yeah, so I was telling you that the prevalence of chronic disease is going up. And I was shocked to see, because I was not prepared to handle the disease, or I would say a syndrome, which is a multiple faceted approach, that how are we going to handle a chronic disease sitting in a clinic? So I started exploring a holistic way because I wanted to get to the bottom of it, or understand the root cause of that chronic disease and where it is going wrong.
So quick question. Can you give us just a brief definition of what chronic disease really is?
Correct. So anybody who is been struggling with hypertension, diabetes, high cholesterol, congestive heart failure, or somebody had a stroke, those are considered one of the chronic diseases, chronic medical problem, or sometimes also called as metabolic diseases, because you have a break in the metabolic system, which is creating a complexity of energy imbalance in our body. And presenting in a different way depends upon somebody's genetic predisposition.
Yeah, and a lot of times, especially our community, is genetic in the sense of we know a bunch of people in the family that's had it, right? You know, or suffer from this chronic disease, right? And oftentimes, those high blood pressure and diabetes, they lead to the heart attack and strokes. Right.
Correct. Absolutely.
So if you say you had somebody walking into your office and they wanted to approach this kind of holistic approach to their weight loss, what would that look like? Like roll out how you would kind of start with the patient.
So first thing first is when somebody walk into Health 360 Degree Wellness Clinic, they're not being judged or measured based on the weight. We're trying to understand the person.
That's really
We understand the dreams, their struggles, their barriers, their risk factor, and then we're trying to understand their mindset, where they are in terms of their wellness journey, so I can understand their person, so I can collaborate and live that life for a second and give them a piece of advice which will be very practical, sustainable, and realistic.
Yeah.
That's empathy at the highest degree, right? And I think what you said, most importantly, mindset. The mindset, because the mind, your state of mind, either begins the journey or never even starts the journey, right?
Yes.
Yeah. I know in our, this month, since we've been talking about holistic approaches to weight loss, we've talked a lot about the emotional and psychological aspects of weight management. Do you see that a lot in your practice?
Yes. So I think before we continue this discussion, I think there is one word which is being flipped around a lot, and I want to just correct everyone, is weight loss, weight management. Let's understand what weight is. We try to understand from a metric. We stand on a machine, and that machine tells me that what I am carrying.
Yeah, they're on the scale.
Correct, on a scale.
It terrifies us all.
But the science has advanced significantly. In last 10 years, science has advanced to the point that we can actually tell you how much of your body weight is divided between a lean weight, which is fat-free weight, and fat weight. So I think it becomes my responsibility to educate my patients and the community is to understand how much of that distribution is between lean weight and fat weight. So that is called body composition. So when somebody comes into Health 360 Degree Wellness Clinic, we don't do body weight. We do body composition. And our goal is to empower them people understand what is their body composition.
Because it's very individualized.
It is personalized,
Yeah.
and it has a value because you do not want to lose lean weight.
Okay. And as you get age, you tend to lose what I call muscle mass, right? Muscle weight. Is that the same thing?
Yes, you're right. So let's break it down in terms of, if we break down our body into two parts. One is a fat weight, one is a lean weight. In a lean weight, let's talk about muscle weight, bone weight, water weight, which is good weight.
How's water lean?
Lean is based on what is healthier for you.
Okay. All right.
Let's talk about fat weight. All the fat on the body is not unhealthy. There are total body fat, and then there's something called unhealthy fat on the body called visceral fat.
Yeah, that's the word I've been hearing lately. It's
Right.
visceral fat. Yep.
So now when we do a body composition, then we know every metrics for that individual, how that person's weight is distribution between a muscle mass, water mass, and then in terms of bone mass, total body fat, visceral fat, and how is it distributed, which means segmental distribution of your muscle mass.
Okay. I got a question for you. So I'm like a huge fan of steak, and that fat around the steak, is that visceral fat I like to eat?
So it's not the straight way. We're going to look into more details after this commercial.
Okay.
That how we are going to use that fat as an energy into storage as a fat as an energy, because they're two different terms.
Absolutely. So we're gonna roll